Welcome to this discussion on the future of cybersecurity, healthcare, and beyond. I'm Nick Giannas, a senior consultant in WittKieffer's IT practice, and I'll be moderating today's discussion along with my colleague, Zach Durst. As the COVID-19 pandemic persists, I hope you and those around you continue to stay well. We feel privileged to have you listening in and taking time out of your day. I think you'll find this conversation to be extremely relevant. COVID-19 has exacerbated the already immense challenges related to cybersecurity across industries, and it is compounded by the move to a digital environment. In healthcare, patient data and safety are at risk and increasingly targeted and vulnerable to cyber attacks. In this program, the speakers look at the challenges of cybersecurity in the pandemic era and how healthcare and other organizations can position themselves to confront these challenges. Let me bring in Zach to introduce our speakers.
Thank you, Nick. So joining our discussion today, we have two excellent and accomplished speakers. Anahi Santiago is Chief Information Security Officer with Delaware-based Christiana Health System and a thought leader on the topic of cybersecurity. As ChristianaCare CISO, she provides strategic direction and oversight to a comprehensive program and leads a high-performing, highly visible organization that serves the organization's patients, senior leadership, all workforce members, and business partners. She collaborates regularly with state and federal regulatory bodies and actively contributes to proposed state and federal regulations that govern policy and information security. Anahi is a member of several information security organizations and an active contributor on national steering and advisory committees. She is passionate and well-versed in areas of information security, privacy, strategic alignment, process development, and overall governance. Adam Isles is a principal at the Chertoff Group, co-founded by the former Secretary of Homeland Security, Michael Chertoff, where he leads the firm's cybersecurity services team. Adam has a 23-year career in law enforcement and security, including early work on cybercrime as a career lawyer at the U.S. Justice Department. He later served as the Deputy Chief of Staff at the U.S. Department of Homeland Security, which is the lead U.S. government agency for managing security risk. He's both a lawyer and a CISSP, and he has spent the last decade working with large global companies in banking, technology, retail, and other sectors that help them understand, manage, and communicate risk. We have two great speakers, and Nick and I believe you will learn and grow from the discussion. Thank you for listening, and let's bring in Adam and Anahi.
Thank you, Zach. And let's get started. Anahi, to start us off with this discussion, what are the elements you are looking for when assessing the maturity of a cybersecurity program, especially as organizations move toward that digital ecosystem?
So there are different levels of maturity, and I think many of us are familiar with the typical maturity model where you've got policies, and then you've got procedures, and then you're implementing, then you're monitoring and process improvement. But when I look at organizations and to determine their maturity, I start by looking at the basics. Are they doing basic cyber hygiene, patch management, monitoring, education and awareness? And from there, start to look at the controls to determine how robust they might be and how the risk management practices are being advanced, because ultimately risk management is the core of everything that we do. And if you've got a pretty sound and robust risk management program, then the rest of the components from a security domain perspective will follow suit. So starting with the basics, looking at the risk management practices, and then determining from there how advanced has the program actually gotten.
It makes a lot of sense. Adam, do you want to jump in?
Yeah, I would totally underscore what Anahi said around risk management is the core of everything we do. And that resonates. And the way we've kind of thought about this is by asking a couple of basic questions, right? Which is, and look, we're working across sectors, and so this is why we need to start with some of these questions. But we start with kind of a discussion around based on your business profile, what kind of risk does that entail? So based on your business profile, how does that make you, more attractive to, a reasonably foreseeable set of threat actors? And once you understand that and the connection between business profile, threat, and impact, you can start to go through questions around, all right, how would the bad guys do what they do? To what extent do we have, reasonable countermeasures in place to defend against that? Many of which are, to Anahi's point around basic hygiene. Does what we have in place actually work? Is it effective? And are we prepared if things go wrong? We try and unpack things around those core questions. But to Anahi's point, everything was back to risk management.
Thank you both. Now we'd like to pivot a little bit and looking at leadership in particular. Where do you both feel are the most important qualities? There's 3 or 4 qualities when looking at a CISO. What do they need to possess? And Adam, maybe for this question, we'll start with you.
Well, I feel a little bit self-conscious answering this question, given your fields and given that, Anahi is actually like walking the walk as opposed to talking the talk. But with that disclaimer, look, I think I laid out the kind of the core set of questions around risk management that I described. And I think, in terms of aptitude, there are kind of 3 buckets that, we tend to see, right? The first is around kind of technical aptitude, right? Do we understand, kind of basic principles of cyber defense, how threat relates to controls, how regulatory expectations feed in, what incident management entails. But then, beyond kind of technical aptitude, we think about organizational aptitude, right? And this is where we're thinking about, look, before we're starting to talk about, whether, web servers are configured, right? We're talking about business understanding and how the work of a CISO relates to enabling the mission, the business of the organization. And that can get in a little bit to kind of communications and presentation skills, kind of executive presence, leadership, and in some ways political skills with a small p. Because I think so much of this work, and again, I defer to Anahi on this, involves seeing to it that the architecture that has been kind of conceptualized and the strategies actually being implemented and updated and kept current in practice. And so the third bucket I look at is really around program aptitude, which is kind of really more around a discipline of kind of planning, strategic management, thinking about policy development and having supervisory skills. So again, 3 buckets around kind of technical, organizational, and program aptitudes.
Anahi, anything you can add?
I think you hit it out of the ballpark. Yes, I mean, when I think about the attributes that make a CISO successful, the first thing that I think about is a business leader, somebody that actually understands the business that they're working in, the industry, the strategy, the organizational strategy, and a leader that is committed to enabling the greater mission of the organization. And that takes, that takes some skill. It takes deliberation in terms of engaging with leaders across the organization to understand what are their top goals, what is the organizational strategy, and how can information security be a partner in enabling that strategy. I also think, I think you used the word political. I would use the word influencer. And that you, as a CISO, you're constantly negotiating, the need for security and the balance with organizational execution. And at times you will run into barriers or, run into obstacles that you will need to navigate, and being able to influence those around you. By using common language and by really demonstrating that you really are invested in a true partnership, it is very important. And then a couple of other things, definitely being a mentor, knowing how to grow a team. I think a lot of times in information security, we look for the unicorns, those very tenured experts to build a team, where the reality of it is that we need to be able to grow the team from within and teach information security as opposed to buying information security at times. And then lastly, a relationship builder. And when I talk about relationships, I'm not only talking about those internal relationships that are needed to be successful within an organization, but also those external relationships that help you to build a network and to learn from each other. Because ultimately, as a CISO, there isn't anybody in an organization that's going to teach us information security and help us to solve some of those complex problems, but our peers can. And so instead of wasting a lot of time and energy trying to figure something out that somebody else already has, tapping into those networks, I think, is a really important component of a successful CISO.
We agree on all of those things that you both mentioned, and would say that, just in summary, that the technical and programmatic skills are important, but the soft skills are critically important, right? Being able to, like you said, Anahi, build relationships, be able to communicate effectively and be able to translate security in terms of business risk and in ways, and be able to communicate in ways that leaders, business and clinical leaders understand.
Yeah, it's those soft skills, Nick and I find when we're talking with leaders across the country, that really sets apart the good from the great CISOs. It's really those that can work. Maybe they'll meet their team in the morning, in the afternoon, they're with clinical leadership, in the evening, they might be meeting with the board. And in each case, they're speaking a different language to those business units. And the ability to understand and to do that really makes a great CISO that we see. And just as a follow-up to that question for both of you, what do you both see as the optimal reporting structure for a CISO? Is it the CIO? Is it legal? Is it elsewhere in the organization? We'd love to get both your thoughts. And maybe, Anahi, we'll start with you.
So I don't know that there's an optimal reporting structure in terms of, it really depends on the organization and the culture. And so that structure just needs to be positioned in a way that a CISO can be successful without having to navigate too many obstacles. I personally, in my two roles as CISOs, have reported to the CIO/Chief Digital Officer. But in both those organizations, the commitment to information security was very strong. And it started at the top with the CEO all the way down to the CIO, CDO, and across the board. What I will say is that what does help is at some governance level to have a reporting structure directly to the board, to a board committee, to the larger board, but to be able to have that line of communication and that ability to be able to go directly to executive management with difficult conversations in order to remove obstacles. But hopefully it'll never get to that. Hopefully the organization is supportive and the board is simply there just to reinforce that support. But I've been fortunate and deliberate in picking organizations that I felt were supportive enough of information security for me to be able to be successful.
I agree with with what Anahi just said, and what I'd offer is that in the work we do, we see different models in different sectors. I'd say in banking, we might see the CISO reporting maybe a little bit more sort of the general counsel or sometimes the chief risk officer, whereas in retail, we see a lot of reporting, and in manufacturing as well to the CIO. Sometimes we also see a kind of a unified chief security officer that has both kind of investigations, corporate security, and information security reporting in. It's getting interesting in manufacturing and other sectors that have significant industrial control systems. Around scope and our industrial control systems, under the responsibility of the CISO. We're seeing kind of evolving trends there. But I think for me, it's what Anahi said. Around look, there will always be some level of tension, and tension is healthy around the extent of risk and risk response and resources that are kind of being devoted to it. And so you get into a question around, from a transparency point of view, is there visibility on that risk, up to, C-suite and board level? And is there then, a sense that there, are reasonable defenses, reasonable countermeasures being put in place from a budget, from a resourcing perspective, such that you can, kind of look yourself in the face and say, hey, look, we've got reasonable coverage, against what's reasonably foreseeable, and we're prepared if things go wrong. And I think the reality, even in organizations that have, reporting relationships outside of the CIO, is the IT operations organization, network ops, they are the human beings that are deploying, whether it's hygiene, whether it's cyber defense tools, the things that, are needed for, kind of a security program to be successful. And so there needs to be a kind of a relationship of trust there, regardless of what the reporting relationship looks like. That also becomes important in an incident, where seconds and minutes count.
And healthcare, oftentimes right now, we see that report up through the CIO, similar to Anahi's report for her last two roles. But Nick and I would both agree with you and Anahi that visibility is so key. Having that interaction with the highest levels, whether that's senior leadership and certainly the board as well, whether that's being a part of the committee or presenting to them, but being able to really showcase some of those risks in ongoing programs is what makes us so effective.
I would add, to something that Ani started with, which is, around the kind of the soft skills involved in a CISO. And I think, a lot of what we had to do, the Department of Homeland Security is to work through integrated project teams, right? Because fundamentally, like for me, one of the biggest differences between successful and kind of less successful programs is around stakeholder management. And so you have, if you think about kind of the life cycle of cyber defense, right? When we're starting with, okay, well, like, what's our inherent risk? The business needs to be involved in that discussion. To Anahi's point, the risk team needs to be involved in that discussion. As you're, and then the security team obviously is involved in that discussion as well. As we move to thinking about threat and what tools, what standards we need to be in place, to address threat. Obviously the security organization is going to be there, but you need IT there. Is the infrastructure there to deliver, network access control that you want, or to deploy, an endpoint detection and response tool that you want. And then you move through to, kind of detection assurance, controls assurance. You start to see, potentially the audit teams to, get interested. And so we've got multiple stakeholders, that need to be engaged and supportive, in our experience, for a program to be successful.
Agreed. So moving on to another topic, recruitment and retention. What are the most important factors in recruiting and retaining information security leaders and staff and developing a diverse and inclusive workforce? Adam, do you want to start us off, Anahi?
I'm happy to start. I think I touched a little bit on this with my opening response in terms of the way to build teams. And, in an industry where there are far more jobs than qualified individuals, I think recognizing that and building a team that has the right mix of talent in terms of seniority versus younger learners, I'll call them, or junior analysts that can be taught. I think it's really important. And so building it, when I look at the folks that I want on our team, I'm looking, when I'm hiring more senior level individuals, I'm looking for people that want to mentor, that have an energy around helping others grow. And then I am deliberate in hiring entry-level positions with individuals that demonstrate a hunger to learn and an eagerness to grow and contribute. And I've seen that, hiring that type of young talent, and I call it young, but I'm not referring to age, I'm really referring to tenure. infuses energy into a team, and that right mix of mentorship and growth has enabled some of the junior analysts to be really strong active contributors within the first 6 months. And to address the talent shortage, what I think has been successful in being able to build a team is to develop a brand as a leader and as an organization where people want to come and work. And I've found that when I have some of those more senior positions, I'm able to get applicants relatively easy because they are familiar with ChristianaCare. They are familiar with the information security program at Christiana, and they're interested in being a part of our mission and vision. And so it takes time and it takes effort, but building that network and building that brand, I think, can help a lot of organizations solve for that shortage program by making one's program attractive.
I think for us, it depends maybe a little bit on what level you're talking about. I mean, we've seen good success also at there's an amazing talent pool in the military. And, you think about that both in terms of active duty, folks that are, looking for a kind of a change in career, as well as the National Guard, folks that are basically working in the private sector, but they have the opportunity to do National Guard service and maybe up their skills, while they're fulfilling their service. University relationships, I think, are also helpful. I mean, we've seen some organizations being, kind of actively engaged with university communities to do that. At the level, as you get to the level of CISO, and I'd love to hear your guys' perspective on this, as being in the business of talent recruitment. But I would offer two observations in this respect. One is, in talking to folks that are being considered, I think there's always a concern around, is the organization hiring me talking the talk, or are they walking the walk? In other words, am I coming into an organization where I'm going to have, the buy-in and the resourcing to, deliver a program that's aligned to risk, or are you looking for a kind of more of a figurehead? And I don't mean to suggest that most organizations do that, but I do think that can sometimes be a concern. The only thing I would highlight is sometimes there can be a tension when, a new senior security executive is coming into place, and the kind of the incumbent remains in place in another role, and you get a little bit of attention around, fresh look versus what was wrong with the way it was being done. And that just takes, I think, empathy and understanding and respect, to be able to work through.
Adam, I'd like to add on to what you had shared about the support from the organization. I think, like in any leadership role, the CISO has to feel supported, right, across the organization. And I also feel that it's important that there are opportunities for growth. Right. And that's, like I said, in any leadership position, but even more so with the CISO, with the challenge of the job and all the factors at play, it's critically important that, you have the support. And that's why it's important to build those relationships across the organization and nurture and develop them. But I think also organizations need to ensure that the position is at an appropriate level where the CISO can be visible, can be in a position to influence and make an impact and serve as that trusted advisor.
Great. So pivoting to our next question here, can both of you discuss your experiences on what you're seeing around the utilization of AI, machine learning, and other emerging technologies as it relates to your security program or others you've seen?
Sure. So it goes back to the maturity of an organization and where, where folks are in their investments. But what I'm seeing is a lot of automation, a lot of taking the human element out for speed to detect and respond. That's where most of that AI is coming into play at this point, whether it's, with security operations, whether it's an incident response. The AI can really help not only to increase the speed of the job that we're tasked to do, but it also enables the reallocation of resources to functions that are higher value than those menial tasks like looking for the phishing email and all those other inboxes, or creating the tickets for vulnerabilities that have been identified in systems. So there are a lot of high value applications of AI that organizations are adopting. However, you still have to have the basics in place before you can get to that point. So especially in healthcare, which is an industry that's working towards maturity. Some of our larger organizations in healthcare are leveraging a lot of that technology, but some of the smaller to mid-sized organizations are really still struggling with figuring out how to do the basic stuff, or how to get the resources to even begin to do the basic stuff. But the technology is certainly improving. And I think one of the advances that I've seen in information security is the movement from point solutions to platforms, and where we had to have 7 different tools for 7 different things. Now we can have one platform that accomplishes over 80% of that, which once again frees up resources to be able to do other higher value things than engineering and system management.
So we're seeing some really cool work, around, the kind of the bringing together of IT service management, vulnerability management, incident management, CMDB capabilities onto a single platform. And that just like, how do you make life easier for people? Right. And so like, okay, so Qualys, identifies vulnerabilities. Okay, let me automate the process of, assigning those out to owners and tracking SLAs for remediation and, getting remediation implemented, et cetera. And, how does that crosswalk with, incidents that we're addressing? So how do we start to, unify a view around there, create kind of an asset-centric view of all of that? I would say more broadly, right, in terms of machine learning, we're seeing like, okay, how do we leverage the power of the cloud? And you think about from a threat detection point of view, kind of cloud-based endpoint detection response capabilities, the ability to start to understand, all right, like what tactics, techniques, and procedures are we seeing used, across the sector? And can we start to identify certain patterns that, build a little bit of a kind of a mosaic theory around like, here are the, hops, skips, and jumps that a threat actor makes once they've achieved some level of persistence inside an organization. Because then I can create detection, rules that are much more precise, and have lower false positives as a result of that. I think when you think about recent threat tradecraft around, SolarWinds and how identity and access management were leveraged to advance, the kind of threat activity there. Thinking about identity analytics and starting to get smarter on, all right, this domain admin does not look like the others, and to create kind of proactive alerting around, kind of use of credentials, new credentials created, I think is going to be increasingly important as well. The third category that I'd highlight is just, I think we're excited around capabilities that aren't necessarily machine learning based, but that are focused on validation, right? And understanding, all right, we have capabilities in place. We spent, a lot of money on them. Are they operating as intended? And so we see a kind of a new kind of cottage industry of what are known as breach and adversarial simulation tools. that can, if you will, emulate threat activity inside an environment to understand, all right, like here's our threat model, here's what we think the bad guys would be doing. To what extent are the tools that we have in place, capable of either blocking or detecting the tradecraft we'd be most worried about?
And I'm curious, as just a follow-up here, are there any industries you feel like are doing that particularly well, that are really ahead of others, and things that healthcare could be looking to as they continue to mature and grow?
Let me offer a general observation first. In my own experience, there is like no correlation between where you are in the Fortune 500 list and the maturity and effectiveness of your security program. My observation generally is that organizations that are, in the middle of that list are often more mature than organizations that towards the top end of that list. And that's for a number of reasons. I think some of it is sector based. Some of it has to do with the fact that like you're a large company that didn't exist 15 years ago. As some of the kind of major technology companies are in this country, you don't have to deal with Windows XP or legacy infrastructure in a way that if you're a large bank in this country, and you've become that way because you've gone through acquisition, you do. I do think that banking has for a long period of time had a lot of regulatory oversight that's been risk-based. And so I'd probably see banking as a sector as being, amongst the most mature we deal with. And two, in terms of things that other sectors are doing, I mean, both in banking and aerospace defense, to Anahi's point around maturity, there's been more definition around what a maturity framework looks like in those sectors. And it's key to inherent risk, which is to say, like, not every organization needs to be at the same level of maturity. And so the more kind of complex you are, the more complexity you have around inherent risk, the more severe the impact of a compromise would be, not just on you, but on the rest of the economy, the kind of the greater level of maturity is that's expected. And so, the kind of the FFIEC, the umbrella, banking regulators group, about 5 years ago released a cybersecurity assessment tool that kind of geared, maturity levels to, inherent risk levels. The Department of Defense has now released something called the Cybersecurity Maturity Model Certification Program, where different vendors to DoD are going to be expected to be at different levels of maturity based on, the kind of the nature of what they do in the defense industrial base.
That's very interesting. And when you look across industries, how some are more evolved than others, and how mature some organizations are to others, I think there's a common theme here, is that as a leader or a staff member in information security, being actively engaged at the local and national level, sharing information and intelligence and best practices is critically important. So
we've been involved with on the retail side, retail information sharing and analysis organization, and it's we help stand it up. And I think that for all the capabilities that it has, threat information sharing, created with DHS, et cetera, probably the most important aspect is around trust, because what's happened, right, is you've had a community of call it CISOs, call it directors of information security, who didn't have necessarily, the same level of networks. And now they have a group of peers, that they see, that they talk to on a repeatable basis, and, get to know, get to meet, and have a, whether it's for benchmarking, whether it's for, kind of best practice, whether it's for, okay, we're experiencing an incident of some sorts. Have you guys seen this? There's a level of trust there that I think it's kind of the power of the crowd a little bit in helping people advance their security programs.
Thank you, Adam. Moving on, we often hear it's not a matter of if, but when a cyber attack will happen. So taking into account that notion, along with the current cybersecurity threat landscape with COVID, et cetera, what recommendations would you have for healthcare organizations in protecting their information assets and patient safety, especially with considering, things like resource constraints and, again, moving to digital?
Nothing to miss or anything, right?
Yeah. I mean, the obvious one is be ready, have a robust incident response program and plan that that you can easily pick up and use when, in the face of an incident. A lot of folks get caught with their pants down. They just don't think it's going to happen to them and invest a lot of money in all of the shiny tools. And we have very big, large teams managing those tools. But when the breach occurs, they don't know how to actually handle it. They don't know who's on first, who's on third. So not only having a good information security incident response plan, but making sure that it's integrated with the emergency management plan that all healthcare organizations have to have that follows the HICS model. There's no need to, the HICS, Hospital Incident Command System. That's a model that has been around for decades to assist organizations in responding to mass shooting attacks, hurricanes, earthquakes, mass casualties. There's no reason why that shouldn't apply also to information security. So integrating that IR plan with the HICS plan is really important. I think what a lot of organizations also forget to do is to marry that all up with a really robust communications plan. Because when an incident occurs, folks are going to want to understand what's happening in real time, whether that's your internal team, whether that's your stakeholders, your clinicians, but also your patients and the visitors and the media. And I think back to a few years ago when a large health system suffered a ransomware attack, and they kept saying, it's not ransomware, it's not ransomware. And the Washington Post was in one of their facilities with a clinician going, oh, no, look, here it is ransom. And so, that creates as bigger problems. Bad communication can create as big of an issue as the actual incident that you suffered. And obviously test, but also make sure that you have a good plan for when that breach occurs and you need to continue to do business. And a lot of times, we think about the plan as information security centric and forget that our clinicians don't test their downtime procedures. They don't even know where their downtime procedures are. And when systems are not available, they still need to be able to take care of patients. And testing that ability is as important as testing the response processes. So we spent a lot of time looking at what the service lines are and the critical paths for care delivery, and ensuring that we have really good downtime plans for those areas, and where there are some critical paths that require investment in technology or resources ahead of time. We've looked to see where those are, so that in the event that we do have a major downtime that may take days, if not weeks, our clinicians can continue to deliver care, and our business can continue to do business. Because one of the biggest issues that a lot of organizations have experienced is an inability to cut paychecks because those systems are not available, and the supply chain, not an inability to order supplies because those systems are not available. So in healthcare, it's really not just about the clinical, it's not the EHR, it's all those other supporting systems that need to be accounted for.
She agrees with me, but I agree with everything that Anahi said. And what I would say is investments now buy time later, right? I mean, every crisis involves, kind of a conundrum around how you balance, incomplete situational awareness potential operational disruption, versus the need to continue to operate somehow and communicate with stakeholders. And so, we can think about maybe at a technical level what a response-oriented architecture might look like. Do we have the sensors and logs that will help us figure out what happened more quickly? From an external resources point of view, do we know who the repeat players are, in response that are going to be on speed dial, the outside counsel, incident response firm, et cetera. And do we have, to Anahi's point around communications, right? Do we think not just about communications, but around sequencing? Who are we going to reach first in a crappy situation where, we're in a bad situation, people are understanding it, and we've got to touch, a whole bunch of people. Who are you trying to get to first before it's in the media? I think it ends up being kind of, a key portion of maintaining trust. One of the things that is particularly disturbing that we're seeing right now is the dramatic increase in, call it double extortion, call it, ransomware with data exfiltration, as a precursor. And this is born of the fact that look, there's no sector that's been more impacted by ransomware than healthcare. But as organizations have gotten smarter around, okay, how are we maintaining backups? Are they resilient to a ransomware attack? How are we thinking about restoration capabilities? The bad guys have figured out that, if we exfiltrate sensitive data before, actually encrypting systems, that will make people, potentially, more likely to want to pay the ransom. And they're all, clever about this, right? So, hypothetically, right, you have systems that are, you see starting to be encrypted, followed shortly by an email from someone basically saying, we're going to go to the media, we're going to go to all of your customers, in the case of healthcare patients, saying that, we downloaded, X sensitive data, unless you pay the ransom. And so you want experts in really quickly that can help contain that situation, provide advice. The default answer is always going to be, well, we're not going to pay ransomware threat actors. Some organizations end up doing that. If you do, right, there's kind of a, cottage industry professional ransomware negotiators that are out there that can help manage the situation if that's the road that that folks need to go down, because, that there are no backups, the backups don't work, or for other reasons.
And Adam, I would add that I've been reading, it's not rampant, but I've been reading about triple extortion, where if the negotiations aren't going well, then you get a denial of service attack on top of the other two.
And we've been hearing also about emails that are now going to customers, or in the case of healthcare patients, saying, this organization has been ransomware, you need to tell them to pay us. As an additional incentive to pay. There are additional complexities, for organizations that are in the unfortunate situation where they may need to think about it, where some of the more prolific actors have been now sanctioned by the Department of the Treasury. And so, if you're in this situation, you need to kind of think about not only do we or don't we, but are we, potentially, violating a sanctions regime. If we do, groups like, are evil, fall into that category. Again, that's where outside experts can come in and be helpful in a bad situation by trying to help you understand whether, you're coming close to someone that is sanctioned or not.
So Adam, now that and thank you both, but now that I'm not going to be able to sleep at night thinking about all these pending attacks in healthcare, let's pivot the conversation to some of the solutions. So, the cybersecurity, as both of you have alluded to, threats are now 4 times more likely to be targeted at healthcare more than any other industry right now, according to industry reports. And so, Anahi, I'd actually like to start with you in terms of what do health systems and organizations need to be doing to protect themselves more moving forward? And Adam, are there some other lessons learned from other industries to protect against these double, triple attacks?
So, I'm being repetitive in some of my answers, but I think it's because I feel that the importance of basic hygiene is so critical. There's so many organizations that, the WannaCry, for example, there was a patch out for months before that pandemic hit. And all those organizations may or may not have been patched. I would say, risk management, know where your risks are, know where your critical assets are, and have a plan to protect them. And I think as importantly is threat intelligence. Share information, join an organization like HISAC, which is very collaborative, and that's the ISAC for the healthcare sector. There's a lot of information sharing there that organizations can learn from without, living in a vacuum. And practice incident response, because ultimately they have to get it right once. We have to get it right 100% of the time, and that's just not realistic. So making sure that you're able to respond if and when you do get hit is critically important.
I would pick up on something that Anahi mentioned around threat intelligence and risk management. I mean, a century and a half ago, Florence Nightingale came back from the Crimean War and basically said, we need a system, right, to kind of classify diseases, outcomes, where they're occurring, et cetera. And that has evolved into, the International Classification of Diseases, version, whatever it is, 11, the World Health Organization maintains. 5 years ago, the MITRE Corporation, which is the country's oldest federally funded research and development center, publicly released for the first time something called the MITRE Attack Framework. And that is a kind of think of it as an encyclopedia of threat actor groups, related tactics, techniques, and procedures, and mitigations and detections. And what that allows is an organization, or frankly, a sector, to start to think about, okay, based on my business profile, who'd be interested in coming after me? How would they do it? What do I need to have in place to defend against myself? And it's focused on tactics, techniques, and procedures, which are, an attribute of threat that is, it's always adapting, but it's relatively harder to adapt than, an IP address or, a malware sample, that may be leveraged in an attack. And so we see a lot of movement across sectors to be thinking about, how do I apply threat modeling at the front end and testing related to that threat model at the back end to try and hone my defenses? And it's the kind of thing that a larger organization, might have internal resources to be able to develop, whereas a smaller organization is going to need help from an ISO, and on the front end, and maybe the services of a managed service security service provider that's aligned to attack on the back end, as well as some testing. But what's exciting to us about this is, we think about trying to bring a level of transparency, accuracy, and precision to understanding risk. And so, what MITRE does is it helps brings a level of transparency to threat. It helps bring a level of accuracy to, threat to countermeasures. And to the point around enterprise alignment, you can start to get to a level of precision around, all right, what machines, have hygiene, have the basic tools that I need to defend against this versus what don't, leveraging kind of an approach like this. So we're really excited about what MITRE's been doing. We think that there's, more potential for it. They've now just released a training program that allows you to become certified, a MITRE attack defender. And I think that's a space to watch.
Well, moving on to our last topic, and I think, boards and senior executive teams would really appreciate your thoughts around this. But what advice or thoughts would you both share in preparing for cybersecurity in 2021 and beyond? And I can imagine some of the things you shared earlier are applicable here, but it would be interesting to hear your thoughts and recommendations for boards and senior executives as we look forward into 2021 and into the future.
Well, I think that the primary point is that cybersecurity is not a technology issue. It is a business and operational risk issue. And start the conversation there. The National Association of Corporate Board Directors, I just botched that name, but they came out with a resource for board of directors around cybersecurity. And I believe there are five top things that every board of directors should be able to answer. And I use that slide in all of my presentations as an ending slide to complete the conversation with, if you cannot answer these questions, and I've not done a good job of dialoguing with each of you. And obviously that's going to look different for every industry. For healthcare, it's about patient safety and care delivery. And so making that connection and then spending some time educating the board so that they understand the threat landscape, what an information security program is designed to do, where our risks lie, it's a good conversation starter to continue the dialogue in subsequent meetings. Because if we don't start with a foundational common understanding of what cybersecurity means to the organization, then it's very difficult to have meaningful discussions. And I think the most important point that I could make is avoid FUD, fear, uncertainty, and doubt. That's not an effective communication tool. And I think information security has used it for too long. Be authentic about the true threat landscape, what that means to the organization, and what we need to do in order to gain the right level of attention that it needs.
I'm going to offer an analogy, and I'm again self-conscious about offering it because I'm dealing with a set of colleagues here that are much more skilled in the healthcare space than I am. But I would think you might think about starting with, like, what's our patient profile? Like, as an organization in a healthcare context, right? Everyone needs to worry about COVID-19 in the same way that everyone needs to worry about ransomware and maybe double extortion ransomware. But then not everyone needs to worry about malaria. There's some organizations that are going to be larger and more complex. They're going to have those additional risks, maybe around research and other sensitive information that become applicable. And once you understand that, then you can think about, all right, well, like, what diagnostics apply to my profile? Like, what therapies, what preventive steps apply to the profile? And then we can think about whether they're calibrated and whether people are trained to use them. And you think about the challenge of ventilators and like getting ventilators in, but like do nursing staff actually understand, are they trained in how to use those, right? As we think about, newer tools, some of the same challenges, we're seeing in the context of security. Beyond that, though, I think Anahi started, with this point in the conversation, there's an issue around inclusion and buy-in, which is we need the patient population to be brought into the system, right? For the system to work. And so in the same way, in a security context, we need visibility on the assets, and we need the patients, if you will, to be taking the medicine in terms of maintaining hygiene, et cetera. And ideally to be tracking that. From a supply chain perspective, we got to worry about salmonella. We've got to worry about post SolarWinds. There are reports this morning around kind of open source libraries and PHP being subverted. How do we think about whether the food that we're bringing in has been tested, has basic health and safety standards there? And boy, is that an evolving field. It's actually an area that I think healthcare is leading in, as you start to think about nutrition labels, so to speak, and the equivalent being software bill of materials. And then obviously, there are a few sectors that are more skilled at emergency management than healthcare. But like, what's the plan if we have to deal with contingencies? And then from a metrics point of view, how do we track all this? I think that you think about some of the parallels at the beginning of COVID-19 to countries, that had, got testing out earlier, that had strong contact tracing, that emphasized how important masks were, basic hygiene, social distancing, and look at the relative performance there. And I think some of those same lessons apply by analogy in this setting.
Great analogy. I might steal that.
Indeed.
Please.
Barb.
Well, Anahi, Adam, we can't thank you enough for sharing your expertise, your knowledge, your time with us today in a very lively and thoughtful conversation. For our audience, thank you for joining us. We hope that you've learned a lot from this discussion and have some meaningful ideas to take back to your organizations to further its cybersecurity efforts. Be safe, be well. So long, everyone.
Thank you so much.
Thank you.
Thank you both.
Thank you for viewing WittKieffer's video. We invite you to visit WittKieffer.com to learn more about our expertise in leadership and view our open searches. You can follow WittKieffer on our socials, LinkedIn, Facebook, and Twitter at WittKieffer. WittKieffer makes no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this video. The information, opinions, and recommendations presented in this video are for general information only. Reliance on the information provided in this video is undertaken at your own risk. This video should not be considered professional advice. Third-party materials or the contents of any third-party site referenced in this video do not necessarily reflect the opinions, standards, or policies of WittKieffer. WittKieffer assumes no responsibility or liability for the accuracy or completeness of the content contained in third-party materials or on third-party sites referenced in this video, or the compliance with applicable laws of such materials and or when referenced herein. WittKieffer makes no warranty that this video or the server that makes it available is free of viruses, worms, or other elements or codes that manifest contaminating or destructive properties. WittKieffer expressly disclaims any and all liability or responsibility for any direct, indirect, incidental, special, consequential, or other damages arising out of any individual's use of, reference to, reliance on, or inability to use this video or the information presented in this video.